Appropriate Use Criteria, or AUC, for Advanced Diagnostic Imaging. Using AUC will allow us to provide better care, improve efficiency by assisting ordering professionals in selecting the most appropriate imaging services for their patients, enhance decision support, and comply with protecting access to Medicare Act requirements. We are now in the testing period for a new CMS mandate which requires physicians or their staff to consult appropriate use criteria prior to ordering advanced diagnostic imaging for Medicare Part B patients. This mandate applies to orders for breast MRI at Elizabeth Wendy Breast Care. The voluntary reporting, education, and operations testing period runs from November to December 2021. This allows time for organizations to integrate the AUC consultation into their workflow. The mandate goes into effect January 2022. There are 3 things you will need to include on your orders for MRI at Elizabeth Wendy Breast Care. First, you will need to include a G-code to identify which AUC tool or clinical decision support mechanism was consulted. Secondly, you will need to include a CPCS modifier code to describe the level of adherence to the CDSM. Lastly, you will need to include the ordering professional's NPI number. EWBC has adapted our breast MRI requisition process to include important information we will need to comply with AUC guidelines. Please note the G-code and modifier code are clearly identified. EWBC can assist you with this transition. Our website, ewbc.com, has a referring provider section which includes links and other important resources about this mandate. Our billing department is available to answer any questions you may have, and our MRI department can assist you in identifying which codes may be appropriate for each patient by indicating it on the authorization paperwork. For questions or assistance, please contact our billing department at 585-442-1830 or by emailing Kylie Bilodeau or Kathleen Keller. You can also reach our MRI department at 585-758-7050. We appreciate your attention to this new mandate and thank you for trusting EWBC to care for your patients.